asking the general population what they think the cranial nerves are and what they think the abducens nerve does, these are the answers we got. Do you know what the cranial nerves are?
Nerves in your eyes.
Do you know what the sixth one is?
I do not.
It's the abducens nerve. What do you think that means?
Helps you move your eyes.
Do you know what the cranial nerves are?
They're nerves in your brain.
Do you know what the sixth cranial nerve is?
No.
It's the abducens nerve. Does that give you any hint as to what it does?
Does it have anything to do with like the medulla oblongata?
No.
Okay.
But good guess.
Hi, Mom. What are you doing?
I'm doing work. Can't talk right now.
Really?
Yeah, why? What's up?
Okay. I just need to ask you a few quick questions.
Go ahead.
Do you know what the cranial nerves do?
They make you think.
Do you know what the sixth cranial nerve is?
Common sense.
No. It's the abducens nerve. What do you think it does?
Drives me crazy, probably.
No.
The main function of cranial nerve 6, the abducens nerve, is to move the lateral rectus, which is the muscle located on the lateral side of the eyeball. This muscle helps to move the eyeball from side to side.
Hi, I'm Cecilia. I'm your nurse today, and we're here to test your cranial nerves, particularly the sixth one.
Okay.
So all you're going to do is you're just going to follow my pen with your eyes and keep your head as still as you can.
The nurse is assessing the patient's abducens nerve by testing her vision as she follows the 6 cardinal directions. The nurse is holding a pen light a foot in front of the patient and instructing her to follow the pen without moving her head. This is an example of an abnormal finding during an examination of the abducens nerve. As you can see in the video, the patient is experiencing a palsy in the right eye. A palsy causes the affected eye to not be as centered and focused as the unaffected eye.
Good. Continue to make heart-healthy choices in your diet to prevent strokes, which may cause abnormalities such as double vision, which can in turn affect your abducens nerve, which is the sixth cranial nerve we just tested. Okay.
Here are some ways in which patients concerned about the health of their cranial nerves can prevent strokes and further heart problems. Strokes, heart problems, and diabetic neuropathy are common causes that damage the cranial nerves. Making heart-healthy nutrition options, not smoking, and taking omega-3 fatty acids, and reducing alcohol intake are all important factors in helping to prevent the onset of these problems that can result in damaging cranial nerves.
Okay, thank you so much. What are the signs and symptoms of damage to the cranial nerve?
Okay, if you have a problem with your sixth cranial nerve, what it will look like is your one eye, usually only one eye, will go in a little bit towards your nose, and it won't be straight on like your other eye.
Okay.
And that's because the muscle on the outside is weakened, and the way to treat that is eye patches, injections sometimes, and if it's that bad, surgery.
All right, well, thank you very much.
Here are some examples in which the abducens nerve is used on a daily basis. Driving a car and just glancing left and right, instead of physically turning your head like your mom constantly nags you to do. Side glancing a look at the cute guy sitting next to you at the library. When you're intensely reading a book on the legal environment of business. Glancing out the window at the birds flying through the sky. Watching an intense action scene in your favorite movie.
So you came back to die with your city? No. I came back to stop you.
Or making the hard decision of what snack you'd like to eat. The abducens nerve is used in everything that you do, which most people do not realize.